Welcome to our AMA-MSS Fireside chat with myself, Haidn Foster, the chair of the MSS, Brittany Ikwuagwu, our Government Relations and Advocacy Fellow, and Drayton Harvey, our student trustee to the AMA Board of Trustees. I want to welcome everyone and thank you so much for joining us today. I also wanted to call out the ability for all of our attendees at today's webinar to post their questions in the Q&A box down below in the Zoom panel. And we will be monitoring those questions throughout our discussion today and reserve some time at the end for all of us to respond to those. So as I mentioned, my name is Haidn Foster. I'm a fourth-year medical student at the University of Cincinnati, and I'm the chair of our AMA Medical Student Section. So what does the MSS chair do? Really, I am responsible for overseeing the work of the Governing Council, which is the management and leadership body in charge of the activities of the section. And I act as the chief spokesperson for our section, both internally and externally across the AMA. The chair is a 2-year commitment. It starts with 6 months of being the chair-elect. You then serve a full year term as chair, and then you have another 6 months where you serve as the immediate past chair. The chair-elect is elected at our November section meetings, and the campaign season for this particular position, as with our student trustee, starts soon. So if you are interested in getting involved in this type of leadership position and are specifically interested in running for chair-elect in November, please don't hesitate to reach out. I'll make my contact information available to all of the attendees of our webinar today. And with that, I'll invite Brittany to introduce herself.
Hi, everyone. As Haidn has already introduced, my name is Brittany Ikwuagwu, and I'm very excited to share that I am this year's GRAF, or Government Relations Advocacy Fellow. A little about myself: I'm in between my 3rd and 4th years. I'm a government medical school in Houston, Texas. Shout out Region 3. And so what does the GRAF do? So the GRAF is essentially your advocacy liaison to the staff. It's headquartered here in Washington, D.C. It is a 1-year commitment where you do take a year off of medical school to come and live in D.C. The application for it opens in the spring, where you submit 2 forms of letters of recommendation, as well as you go through an interview process. And after that, you find out if you are chosen or not. As part of the GRAF, my job is to be able to organize National Advocacy Week, or the NAW, and the Medical Advocacy Conference, which happens every year in the spring, as well in Washington, D.C., or virtual. We'll see how that goes. But other than that, I am here to help you with any of your advocacy questions. I'm here for everyone within the MSS. And so I will pass it on to Drayton.
Hey y'all, my name is Drayton Harvey. I am your medical student member of the AMA Board of Trustees. I am also a MD PhD candidate at the Keck School of Medicine of USC, now starting my 3rd year of graduate school, 5th year in the program overall. And just like Haidn's position as chair, the medical student member of the Board of Trustees is an elected position within the medical student section that also will be up for election at this November meeting. So the same place you go to look if you're interested in running for chair-elect in November, you also will find information on running for our Board of Trustees member-elect as well. If you search for Medical Student Leadership AMA, you'll be able to find when they are released and the campaign season has begun, the application materials as well as instructions on how to conduct a campaign within our rules, which are governed by a speaker's ruling, which is just another reason for y'all to find the Facebook page for the AMA Medical Student section, where this information, including the speaker's ruling, will be posted. So what does the Board of Trustees do? Well, our organization as the American Medical Association operates a little bit like its own government. So we have a House of Delegates wherein delegates from every state, specialty, as well as special sections, such as the medical student section, have representation to determine our policy as an organization. So you can think of our House of Delegates kind of like our own Congress. It's our legislative branch within the AMA. The Board of Trustees then is our executive branch. The Board of Trustees is given oversight of the finances of the organization, as well as in implementation of our policy. Now, we have many different business units within the organization that focus on different things, from membership to advocacy and litigation, and all these business units report to the Board of Trustees as well as our senior management of the organization, which then help to lead the overall vision for our organization. It's a 21-person board, which includes a dedicated seat for a medical student, a dedicated seat for a resident or fellow, as well as a public member that is seated on the board to represent the full spectrum of medicine and include the public perspective as well. And with that, I'll pass things back to Haidn, and I believe we're going to start talking a little bit about updates about what's going on in the section and advocacy performed by our AMA.
Well, thank you, Drayton, and thank you, Brittany, for your introductions. I will start us off talking about, first of all, I think that most of the people joining for this fireside chat will be familiar, just in broad strokes at least, with our AMA, with our medical student section, and the role of medical students within the AMA. But to give you all a brief primer, just in case, the medical student section, or the MSS, is comprised of all of the medical student members of the AMA. It's one of the largest sections in our AMA with over 55,000 members. And the medical student section plays a unique role within our organization with advocacy priorities that touch on issues of medical education, but also health equity, public health, and many, many, many more topics. And now, with that sort of foundation laid, I wanted to give some brief updates regarding some of the new developments of ways to get involved and have your voice heard within our medical student section. The first of which is through the establishment of 2 new standing committees. Recently, the Governing Council took action to establish the Committee on American Indian Affairs and the Committee on Disability Affairs. We felt like there was reason to help elevate the concerns and priorities of the members who may be interested in participating in these standing committees, members who may have felt like some of those issues have not been historically very well represented within our MSS or within our AMA, and certainly areas that we prioritize as a medical student section. With that said, the applications for those standing committees that we've just established, as well as many more standing committees that we have as a section, will also open up for their mid-year application cycle around November, when elections for Drayton and my position will also be occurring. So if you're interested, like Drayton said, search for AMA-MSS leadership on Google or your search engine of choice. It should be the top result, and you can find more information about how to apply to those standing committees. Standing committees allow for members to work on topics of education, also to evaluate and propose policy, to be social with other members who have similar interests, and lots of other great ways of getting involved in particular areas of interest. One additional thing I wanted to highlight as a mechanism for getting action taken on policy, I'll note that our standing committees that we just created actually were the result of something called a governing council action item. And this is a mechanism by which students who have an idea of an action that they would like to see our MSS Governing Council take action upon based on existing policy or based on the internal operating procedures of our section, can actually submit a request to our GC to evaluate and then take action on. So this may result in, as it did recently, the creation of a new standing committee. It may result in a letter to our Board of Trustees on behalf of our section. It may result in the establishment of a new educational series or webinar. There are as many different advocacy topics and priorities that you may have as a member. There are at least that many ways that we can act on them within our MSS and take action on the policy that we have established. So we'll be sharing additional details about how to submit a GCAI or a Governing Council action item with all of the participants in today's webinar as well. And then finally, I wanted to note that in addition to some of these ways of becoming more involved in our section and getting action taken on existing policy, of course, a core aspect of our medical student section is the ability for our members to get engaged by writing new policy. And we've seen some tremendous success as a section in getting really tremendous policy passed through the MSS, and then being successful in bringing that policy through to the AMA at large. We have a new video that was just released by the AMA on YouTube featuring the work of some of our medical student members in advancing AMA policy relating to racism, relating to diversity and equity within our AMA and more broadly for public health. And so in addition, we will follow up with additional information about how to find that video and learn even more about the really fundamental role that our medical students have had in advancing our organization on issues of diversity and equity. So with that, I'll pass things off to Brittany to continue talking more about the advocacy and policy successes throughout our AMA.
Thank you so much, Haidn, for that. So as part of the graph, part of my responsibility is to keep moving forward on the policy that the MSS brings forward. And so I'm super excited to share with you all today some of the success stories we've had in terms of advocacy. So recently, thankfully to some members within the MSS who's brought to my attention, we made comments on a proposed rule on the use of ghost guns, which are homemade guns, in an effort to promote gun safety. And that is something that, as I just mentioned before, that some members within the MSS contacted me, and I was able to go to the staff and see what we can do. Another example, based off of an MSS written resolution that was passed, I recently wrote a letter to the Department of Homeland Security on alternatives to detention for our immigrant and migrant population in the United States. It was really great to be able to advance forward on something that the MSS wrote and see how that has been elevated to the national stage. Additionally, with the effects of the COVID-19 pandemic, the AMA has been at the forefront of dismantling any COVID misinformation and promoting vaccines for everyone. And so a great example of that, our immediate past president, pardon me, our immediate past president, Dr. Susan Bailey, recently gave a really great testimony talking about how important it is for us to get vaccinated and improving that vaccines really work. And then in that same vein, and continue to our commitment that the AMA has proven to health equity, we recently sent a 14-letter report discussing, amongst other things, how we are all very supportive of how to achieve health equity. And so I really want to take this moment to share with you all that I am here to fight for some of the priorities that you all have, and my door is always open whenever you would like to discuss any type of advocacy project. All right, thank you so much, and then I'll give it to Drayton.
Well, thank you so much, Brittany. We really have fantastic leadership from our medical student section, both in Haidn and Brittany, as well as the rest of our medical student section governing council that is not here today. But today I'm going to speak from the perspective of what's been going on organization-wide in advocacy. And I always like to start talking about advocacy in terms of what the AMA's 3 main focus areas are. So that's 1, removing obstacles that interfere with patient care. 2, driving the future of medicine by reimagining medical education, training, and lifelong learning, and by promoting innovation to tackle the biggest challenges in healthcare. And 3, improving the health of the nation by leading the charge to prevent chronic disease and confront health crises. Now, I would be remiss to not start off by talking about our advocacy by not focusing on the COVID-19 pandemic. So these past 18 months have faced the greatest public health crisis of our generation. Since the beginning of the pandemic, our top priority as an organization has been delivering the tools and support America's physicians and trainees need, and fighting for resources all healthcare workers need to care for patients stricken with COVID-19. Our AMA has responded to COVID-19 in 4 important ways. 1, by providing trusted evidence-based resources and clear guidance to physicians on the front lines, resources which can be accessed for free on our AMA's website. 2, by helping physicians and practices recover from the disruption and damage of the pandemic by pushing for loans and other forms of financial assistance and providing guidelines on how to safely reopen. 3, by pushing the highest levels of government to deliver necessary equipment such as PPE or to reduce obstacles to patient care. And finally, 4, advocating for science-based, equitable policies on pandemic control strategies, testing, and vaccine development and distribution. Now, we've already discussed health equity a little bit, but I want to spend some more time discussing what has been happening in the past year in the health equity space. Our AMA is leading an aggressive effort to eliminate longstanding inequities within our health system, remove barriers to care, and improve outcomes for historically marginalized populations. Our AMA has been working, for instance, this year to reverse executive actions that restricted access to care for LGBTQ patients, advance policies directed at maternal health improvements, improve care for unaccompanied children at the border, further expand Medicaid, expand access to reproductive health care for low-income women, and increase incentives for physicians to practice in underserved areas. This past May, the AMA released its plan to embed racial justice and advanced health equity, which lays out 5 strategic actions that advance health equity and justice, address inequities, and importantly, work to improve patient outcomes and the quality of care for all people. These actions include embedding equity and racial justice throughout the AMA by expanding capacity for understanding and implementing anti-racism equity strategies via practices, programming, policies, and culture. By building alliances with marginalized physicians and other stakeholders, pushing upstream to address determinants of health and root causes of inequities, ensuring equitable structures and opportunities in innovation, and finally, fostering pathways for truth, racial healing, reconciliation, and transformation for AMA's past. The AMA's Health Equity Plan was developed and informed by policies passed by our House of Delegates, as has been mentioned, largely pushed by efforts of our medical student section, as well as by physicians and experts in health equity. It is grounded in science and based on the evidence that shows the harmful effects, such as avoidable illness and early death from racism, sexism, and other systems of exclusion and discrimination on the health of individuals and their communities. Social inequities and their consequences for families, healthcare, and our nation's future are far too great for AMA to be a passive bystander when our mission is to improve the health of the nation. The existence of racism within medicine and society, both historically and present day, is not up for dispute. The only question is how we as physicians and trainees will lead in confronting the health implications of it. Some of the Center for Health Equity's work also includes specifically the National Release the Pressure campaign to promote improved heart health for Black women, health equity resources and learning modules on AMA Ed Hub, which if you haven't checked out yet, you really should, as there are plenty of great resources for our medical students in addition to our physician members of the AMA. A $2 million investment in Chicago-based collaborative to address determinants on health on the city's west side. And finally, a medical justice and advocacy fellowship that launched just this year. Speaking of that fellowship, it was launched just a couple months ago in conjunction with the Satcher Health Leadership Institute at Morehouse School of Medicine. The fellowship will cultivate physicians as the next generation of advocacy leaders, driving meaningful policy and structural changes that ensure equity and justice in medicine in their communities. Under the mentorship of renowned multidisciplinary health equity experts, the fellows will work collaboratively to generate and exchange solutions for implementing health equity projects focused on ensuring better health outcomes and closing health gaps for patients in their communities. This inaugural class will take place from September 2021 to November 2022. Finally, I wanted to discuss another initiative that just launched, which is the Equity and Innovation Advisory Group, which will provide guidance and support for the AMA to ensure equitable innovation in healthcare, an approach outlined in our strategic plan. The advisors are tasked with providing direction on a shared vision for a U.S. healthcare innovation sector that, one, prioritizes resource allocation for meaningful solutions to advance health, racial, and social justice, and two, ensures that race, ethnicity, sexual orientation, and gender identity of innovators mirror that of the nation. In the words of our president, Dr. Gerald Harmon, convening this advisory group is a major step forward in expanding the AMA's work toward equitable innovation in healthcare. Through the combined expertise of physicians and innovators, we can continue to drive the future of medicine by promoting innovation and digital health solutions designed to tackle one of the biggest challenges in healthcare, improving health for our most marginalized patients and communities. Now, I want to close by talking about the topic of diversity in medicine, related to health equity, but an important standalone issue for our organization. We know that fewer than 12% of physicians in the United States come from underrepresented communities, even though these communities make up more than 30% of the total population. At the AMA, we are working on ways to increase physician diversity through scholarship assistance and pipeline programs. For example, new policies were adopted at this June's special meeting of the House of Delegates, which was virtual due to the pandemic. Those policies include recognizing how some people have been historically underrepresented, excluded from, and marginalized in medical education and medicine because of their race, ethnicity, disability status, sexual orientation, gender identity, socioeconomic origin, and rurality due to racism and other systems of exclusion and discrimination. Another policy passed was our commitment as an AMA to promoting truth and reconciliation in medical education as it relates to improving equity. Importantly, we passed policy that recognizes the harm caused by the Flexner Report to historically Black medical schools, the diversity of the physician workforce, and the outcomes of minoritized and marginalized patient populations. Relatedly, we passed policy that we will work with appropriate stakeholders to commission and enact the recommendations of a study of 21st century medical education focused on reimagining the future of health equity and racial justice in medical education, improving the diversity of the healthcare workforce, and ameliorating inequitable outcomes among minoritized and marginalized patient populations. Outside of recently passed policy, we also have initiatives through the AMA Foundation that, in collaboration with our Minority Affairs section of the House of Delegates, provide scholarships for fourth-year medical students. We have as well the Doctors Back to School program, which encourages children from minoritized communities to consider pursuing careers in medicine. Our work also includes working in federal court to protect international medical graduates, as well as physicians and medical students with Deferred Action for Childhood Arrivals, or DACA status. Our AMA joined 32 other leading healthcare organizations in filing an amicus brief to ensure the US Supreme Court upheld the DACA program that has so richly benefited our medical community. We applaud the High Court's ruling in DACA's favor. And with that, I think we are done with our advocacy update, and I believe happy to move on to taking questions from all of you.
Well, thank you so much, Drayton. Thank you, Brittany, both for your incredible updates regarding the work of our organization. And as Drayton mentioned, we'll now take any questions that you may have. Please feel free to enter them into the Q&A box below where you see all of us showing up on your screen. And as those come in, I'll direct them to our panelists.
While we're waiting for the questions to start rolling in, Haidn, can you tell us a little bit more about the structure of our governing council and the other roles that are included?
Why, thank you, Drayton, I can. So as Drayton alluded to, the work of running our section is not a one-man or woman operation. I have a team of fantastic leaders whom I work with, including our vice chair, our section delegates, our section speakers, as well as our at-large officer. And together, we facilitate running things from a standing committee perspective, ensuring that everything is running smoothly with our regions throughout the MSS, ensuring that we have strong representation and a voice throughout our House of Delegates with our section delegates, and then making sure that things run smoothly when we all meet together as an MSS assembly as well with our speakers. And with that, we have a few questions that have started coming in. The first of which is, how can first-year medical students start to get involved in the MSS and the AMA? And I'll go ahead and take that one. So I think that, as I mentioned previously about our standing committees, that is a really fantastic way to start getting involved in national leadership, national positions where you can find particular topics that you're interested in as a medical student and apply to and serve on those standing committees and develop educational materials, work on policy review, whatever may be interesting to you and relevant to the work of the committee. There are also, at almost all of our medical schools, local campus sections where you can get involved at the local level as well, and get involved in leadership within your own school. There are also regional levels of leadership opportunities and much more. But for M1s, I would probably recommend getting involved in our standing committees, maybe our convention committees that help us run each meeting, and then also at the local campus section level. All right, the next question is, how would you best advise MSS members to write GC action items if they are new to the process? I'll probably take this one as well. So we have worked as a governing council very diligently to try to improve and make more accessible the GCAI process. So again, in the materials that we're going to be sending out after this webinar will be included a link to our MSS policy and advocacy page. You can also probably find that in a search engine by typing in AMA-MSS advocacy and policy. And that will bring you to a few different linked resources, one of which is the digest of our Governing Council action items, all of those that have been submitted, when they were submitted and the action taken on them, as well as a frequently asked questions regarding the GCAI process. That will have a lot of the information that you're probably interested in finding out, what the turnaround time looks like for those decisions, what sorts of results you can expect, things like that. And then there will also be a link to submit an actual GCAI, and that will take you to a web form where you can fill it out. I will hand over the next question to Drayton to read and also respond to. And this is from Sarah Mesa.
Okay, so our next question. In the August 30th letter mentioned around the proposed budget reconciliation legislation regarding drug pricing, there is a provision indicating that the AMA believes that any proposal should include safeguards to ensure that if international index pricing strategies are used, they're utilized as a part of drug price negotiation in a way that upholds market-based principles. The question then is, what is the AMA envisioning in terms of market-based principles, and how does this interact with the AMA's advocacy around an HR 3 solution for Medicare negotiation to reduce pharmaceutical prices? So we'll love inside baseball questions. The AMA is committed through our policy to reducing the cost of drug prices, which is an enormous barrier for our patients to receive the care that they need and that we are trying to provide as future physicians and our physician colleagues. Our activity on this is extensive, and I again would refer for everyone to look at the letter that was submitted to Congress, including both members of the Senate and the House, and our priorities for the reconciliation bill, which for all of those of you who maybe have heard about but are not quite sure what is the reconciliation bill, is our new hot word in Washington, D.C. I'm sure Brittany has heard it probably every hour for the last month and will for the rest of September as this is negotiated. But the reconciliation bill is the bill through which Congress will enact much of healthcare reform as well as economic reform that is not included in the soon to also be voted on infrastructure bill. And so this will include our priorities such as those on ensuring permanent expansion of the increased subsidies within the ACA marketplace and preventing the subsidy cliff, as well as is mentioned in this question, drug pricing reform. So HR 3 is a bill that came last Congress as well and has been brought forward this Congress related to drug pricing, and is one of the main vehicles which in drug pricing reform is being targeted. Whether that language is ultimately included in the reconciliation bill is yet to be seen, but we are dedicated to ensuring that the final legislation includes protections for patients to help finally reduce some of the cost from drug pricing. Now, to specifically get at what is the AMA envisioning in terms of market-based principles, that is to ensure that if there's any sort of international index pricing strategies that is used based upon our internal policy as an organization, our AMA's policy on drug pricing reform, that it's done in a way that recognizes systems that operate as the United States does, which is in a multi-payer system. And so that we're kind of comparing apples to apples and not apples to oranges in that process.
Thank you so much, Drayton. And Brittany, I wanted to see if you had any additional comments regarding the previous question, and if not, a question for you.
Yeah, so I know there have been some questions about how more to get involved, which is kind of one of the main questions that I kept on asking. And now I'm Graf, that I started off as an M1. How do I best get involved? Because I immediately had a passion for the MSS. And as Haidn, you already mentioned, being able to work within like your local like school chapter is a really great first step to kind of orient yourself to how the MSS works, which, not gonna lie, even I still have some trouble finding out how everything works. But being very diligent in trying to ask questions. And so that is something when I first started getting used to being around the MSS and what that means. I had to continually ask questions to figure out how things work, whether it be with writing resolutions or how do you maximize, advocacy efforts from your school's chapter, either during National Advocacy Week or on your own. And so understanding that especially S3 up here are a resource to you and not feeling as if we are not accessible. That is something, if that is in your mind, I really hope me saying these words kind of dispels that. We are all here for you. If you have any ideas, any questions, or you would like some feedback, I'll put my email in the chat. I'm really here to kind of hear what you all have to say and give my thoughts about what you would like to do. So don't feel apprehensive or scared or any of that. The reason why one of the MADA's members move medicine is because it's beautiful what we can do, what we can achieve like when we work together.
Thank you, Brittany. I would love for you, if you wouldn't mind, sharing a little bit with our attendees about the experience, the really unique experience of our Government Relations and Advocacy Fellow in working directly with AMA staff on the Hill with key stakeholders in a unique role that I think really isn't replicated by any other leadership position within our MSS.
Yes, it's definitely been a really great learning opportunity for me. Making that transition from being part of the MSS to the staff side, I think I have gotten a real look at the nitty-gritty of what it means to be part of the AMA. And so in that experience, I've just been able to really learn more about the healthcare system in the United States and really more what all the great work that the AMA does to protect our physician and medical student-like colleagues. And so it has been a great wild ride so far. I started it in June, so it's only been about 3 months, but I can definitely say in these past 3 months, I have learned so much, and I'm excited to share that all that knowledge.
Thanks so much, Brittany. I think this next question is most appropriate for Drayton, with the caveat that we realize that there are some areas of AMA policy that may be a little bit more limited. So with that in mind, with the Texas abortion ban taking effect this morning, how is the AMA being proactive and not just reactive on protecting abortion as patient care and as a medical decision, recognizing that the AMA put out a response statement today as well?
All right, yeah, the big questions today. And I know today is a very sad day in respect to what has happened in Texas, and we as an organization are disappointed in the fact that this wasn't able to be prevented. So I will go ahead and again just kind of let you know the viewpoint that was put out from our president, Gerald Harmon, this morning, which was that the American Medical Association is deeply disturbed by Texas Senate Bill 8 and disappointed by today's inaction from the U.S. Supreme Court, allowing this egregious law to go into effect. This significant overreach not only bans virtually all abortions in the state, but it interferes in the patient-physician relationship and places bounties on physicians and healthcare workers simply for delivering care. opening the door to third-party litigation against physicians severely compromises patient access to safe clinical care. The new law is a direct attack, in our view, on the practice of medicine and patient reproductive health outcomes. As physicians and leaders in medicine, we urge our nation's high court to take action immediately and stop the implementation of Texas SB 8. Failure to do so places physicians' clinical judgment and patient access to safe care in dire peril. So again, that was the viewpoint put out today by our president, Jerry Harmon. I would also point to our organization's efforts, not just this year, but in years past, in litigation, joining amicus briefs, protecting that most important principle of the physician-patient relationship, as well as in fighting against regulatory authorities that have tried to interfere similarly within that relationship.
Thank you, Drayton. Brittany, did you have any additional thoughts on this particular question?
Yeah, really just reiterating everything that Drayton said. It's just sad as a fellow Texan, but I do agree with the statements that the AMA put forth.
Thank you very much. As we are coming up on the end of our time, I wanted to once again just mention that we do have that Q&A box down below at the bottom of your screen. If you have any last questions, we would be happy to facilitate answering them. So we'll just give a few seconds for any last questions to come in, and then if there aren't any, we'll go ahead and wrap up.
I kind of have a question for you. Wait, no, there is one question. I'll roll that back.
Sounds good. All right. Well, we have the question with the new Standing Committee on American Indian Affairs. The section has really pushed past easily forgotten land acknowledgements or passive inclusion of Indigenous peoples in our advocacy. How is the section planning to increase the near invisibility of American Indians and Alaskan Natives in the MSS to actually have these students involved in these issues instead of just being a discussion point? And I'll go ahead and take this question. So I think that one of the things that I am really excited about, one is our liaisons to the MSS from organizations such as AMA-MSS that help advocate on behalf of students from American Indian and Alaskan Native backgrounds who are involved in medicine. And so that is a really key way that we bring forward perspectives and lived experiences and priorities of members from these backgrounds, as well as who make it a priority to bring those conversations to the fore and bring policy in support of our American Indian medical students, as well as our patients within the MSS and more broadly. That said, I'm really excited by the potential and the expectations that I have for our new Standing Committee on American Indian Affairs, and the ability for that new body to work on exactly these issues, to bring forward topics that, you know, not all of us as medical students have thought about, have the expertise or the lived experience in, to be able to make really well-informed and well-reasoned areas for suggestion regarding our policy, regarding development of new education, et cetera. So one of the things that I think is baked into the question is that a lot of this work, I think, will be advanced by having a standing committee dedicated to these students and to these issues. So I will go ahead and go around. Oh, we have one more question coming in. We'll go ahead and make this the last question. But despite the AMA passing a policy on a public option last November, our July 30th letter to Congress on public option proposals appears to emphasize building on the ACA as a major approach. How have our BOT and advocacy staff been interpreting and implementing this policy on the Hill? And so I'll let either Brittany or Drayton take that, whoever gets to it first.
So I'll start off on first and say that we have been approached by Congress to provide insight on what a public option legislation should look like. And we did provide a letter which was publicized on that point. So we are acting on that policy currently and providing our insight governed by the policy that was recently passed on what our AMA would like to see in a public option if it was proposed in Congress. In this question as well kind of references our focus on healthcare reform. So I just wanted to emphasize this as it was asked a little bit as well on the reconciliation issue. And so some of the things that we are looking to focus on in the reconciliation bill are looking to expand eligibility for premium tax credits and increase tax credit amounts for young adults, stabilize and strengthen the individual market, such as establishing a permanent reinsurance program, improve the individual market risk pool, such as providing adequate funding for an expansion of outreach efforts to increase public awareness of coverage options and financial assistance availability. And then finally, I think we can't really talk about this without talking about our efforts at the state level as well, where we believe that Medicaid expansion should be a priority to reduce the number of uninsured individuals. And so we are working on that front as well. And I think important for those who weren't around for this fight, but we have always fought in these last few years in the Supreme Court and the protection of the sanctity of the Affordable Care Act, and thankfully won even in just this last case, which was Texas versus Azar. With that, I'll let Brittany discuss any further advocacy points on this.
Yeah, thank you so much. So the only thing I really just wanted to add was really, and just in terms of the advocacy staff, our emphasis on believing in the policy that we pass and making sure whenever we do speak on policy on the Hill, we're always referring back to the AMA policy. We are always making sure that anything that we move forward with is based off of the will of the House. Yeah.
Well, thank you very much again, Drayton and Brittany. I think that is a really fantastic note to end on because it speaks to how member-driven our organization really is. All of the policy that informs the work that Drayton and the rest of the Board of Trustees acts on, that affects how Brittany acts on the Hill with our other advocacy staff and the initiatives that they have, and that govern the actions of our section as well, are all established by members of our organization writing policy, getting feedback on that policy, and ultimately getting it passed through their own delegations and then through the House of Delegates. And so that if that's not a call to action to everyone on this call to at least be aware of the policymaking process and ways that you can get involved, if not writing your own resolutions and then trying to get those passed through our section and through the AMA at large, then I don't know what is, because you really do have a voice and have power as medical students to be able to make meaningful change within our section, within our organization more broadly, and within public health and the public discourse outside of our AMA too. So with that, I'll invite Drayton and Brittany to make any final comments, and then we will wrap up. And I just wanted to again thank our two panelists as well as all of our attendees today.
Thank you all for joining us this evening. It's going to be a great year. I can feel it. I'll put my email in the chat if you want to ask any more questions or have any other ideas. But yeah, thank you all so much.
Now, there's not much more I can add to the great words from the MSS chair, Haidn, and our graph, Brittany, but to just agree that, membership moves medicine, and the medical student section especially moves our AMA. I think it moves us forward as we continue to progress as an organization. I will also share my contact information in the chat function, and please feel free to reach out to me if you have any questions or if there's anything that I can be of assistance on. And I hope you all have a wonderful rest of your day.
All right, thank you all. Thanks to everyone who attended this evening. If you have additional comments or questions as things move forward throughout the year, in follow-up to this webinar, we will make sure to get all of our contact information sent out to everyone, as well as all of those talking points and additional resources that were mentioned throughout today's webinar. So thank you again, and we hope you have a wonderful evening.